Good morning. I'm Deputy Mayor Herminia Palacio. We are here today to welcome back a strong leader to the City of New York government. David Hansell is the ideal person to guide ACS as we continue to reform it. This is a man who has been a fighter for children and families his entire career. And I want to pause a moment to recognize where we sit. We sit at the Nicholas Scoppetta Children's Center, named for a man who served as Deputy Mayor for Criminal Justice, who served as Fire Commissioner, and for this event, most notably, served as the first ACS Commissioner in New York City. A man whose dedication to service was informed by him having been a foster child himself. As we shift back to David and I have had many conversations leading up to today's announcement. We talked about his background, his values, his experience, and his vision for the agency. David has a unique blend of expertise and passion for helping others, and this will strengthen ACS in our mission to protect our most defenseless children. He is a skilled, data-driven manager and someone who knows how to transform organizations. He's someone who will think and work across the many systems that we must weave together to provide the strongest safety net for our children and to strengthen our families. He's also a compassionate advocate for vulnerable New Yorkers. As a physician who spent much of my career caring for patients with HIV and AIDS, I understand the deep, long-lasting impact that this experience can have on a person. David has spent many years on the front line as an advocate during the heyday of the HIV/AIDS epidemic, fighting for people's rights, fighting for people who were often marginalized, discriminated against, unseen, rendered invisible. David was there, protecting people. That work led him to take on tough issues on behalf of the people who need help the most. This was true when he was acting secretary at the Administration for Children and Families in Washington. It was true when he was commissioner of the Office of Temporary Disability Assistance and the Associate Commissioner of HIV Services right here in New York City. Now David will bring his experienced, compassionate leadership to ACS. And I'm thrilled that he's taking on this role. New York City's families and children, we are lucky to have him. And now I would like to introduce a man who's been focused on child welfare for most of his illustrious career, our Mayor, Bill de Blasio.
Thank you very much, Dr. Palacio. Let me start by thanking our Deputy Mayor for the very comprehensive search that she led, looking all over the country for the very best talent, and for the work she did to get to today. And I could not be happier with the choice that she put forward to me, and I ratified. The fact that we're here in the Scoppetta Center, I want to just dwell on that for a brief moment, because Dr. Palacio made the point. This was a great New Yorker. We lost him last year. But I think he would have said, if he were here today, that he valued everything he did in his public life. He valued the time he was a deputy mayor and he was fire commissioner. But I think his labor of love was when he was ACS commissioner. And Nick Scoppetta, because of everything he went through in his youth, but because of his extraordinary compassion, believe that something could be done better and something could be done differently to protect and to uplift our children. He'd also say this is work that never ends, that the efforts to figure out how to do it better are something we work on every day of every year. And no one is better suited to that mission than David Hansell. I want to talk about David, but first want to acknowledge and thank for joining us our Deputy Mayor, Richard Bury, our acting ACS Commissioner, Eric Brettschneider, and the Chief of Detectives at the NYPD, Bob Boyce. Thank you all for being with us. Now, I want to affirm, as I met with David and reflected back on the very positive experiences that he and I had years ago when I was chairman of the General Welfare Committee in the City Council. I thought about the mission ahead. And the 8 years I spent as chairman of that committee were a time where I got deeply involved on issues related to ACS. And to me, they were the most important issues we dealt with on that committee. They were the ones that moved me the most humanly, in large measure because I was a parent. And it was clear to me that there was much more that had to be done back then, and there's more that has to be done now. It takes someone with extraordinary compassion and extraordinary drive to keep working through these issues, because bluntly, this means looking into some of the worst challenges of humanity. That is just the fact. What ACS does is goes into family settings that are so often troubled or even broken. And our ACS workers have to go in there and find a way to protect children and make things as right as possible. It's very tough work. The problems that plague our society often concentrate themselves in individual families, whether it's substance abuse, whether it's a history of violence within the household, or just plain poverty and lack of opportunity. Our ACS workers have to serve at the front line and do their best to address these challenges. And it's never, ever easy. It takes courage. It takes tremendous strength and resourcefulness. Our job is to help them get better all the time. Our job is to support them in that work, train them better than ever. Our job is to make sure all other city agencies have their back and are working with them. And again, I want to give particular thanks to Chief Boyce. I know this is a passion of his as well, and his presence here is an example of the growing partnership between ACS and the NYPD. Now, David enters into a situation where the sheer magnitude is daunting. Up to 60,000 cases a year have to be investigated. And these are, again, often complex and painful situations. They don't present themselves cleanly and obviously in many cases. It takes a lot of careful work to figure out what's really going on and what's the right solution. But David understands that our mission is simple and yet extraordinary at the same time. The goal is to save every single child. And we understand how daunting that is. We understand that there are times when we don't even have an indication that there is an issue in the family or an indication that a child is in danger in any way. But our job, our mission, is to find a way to save every child. There is no other agency in this city government that I think has such a rigorous demand placed on it, or has such a clear and extraordinary goal that it tries to meet every single day. But David Hansell understands that from a lifetime of experience and a lifetime of extraordinary work on behalf of others. He understands how challenging the mission is, but he also understands that leadership and resources and support and training can make all the difference in the world. And I am convinced he is the person who will take us to the next level that we have to get to. As you heard from Armenia, his career has all been about protecting vulnerable people and vulnerable families. And I have seen in my own experiences with David, and I've heard from others as well, he does not back down from a challenge. He has a personal strength to understand that no matter how daunting the social problem he deals with, it's his job to make a difference, and he knows he can. As you know, he served in our national government in the Obama administration, and he was known from that experience as a highly effective manager. He was known as someone who got the job done. He helped run one of the biggest job efforts in federal history. Helped to create jobs for 250,000 low-income Americans in 42 states. Extraordinary managerial and logistical challenge, and David met the challenge. He also understood that his job was to right wrongs of the past, and we all know there were too many times where families struggled because child support was not being provided the way it was supposed to. In his work in New York State, he ensured that caregivers and children received historically high levels of child support payments, literally the all-time record for those payments. $1.6 billion occurred on his watch. And you heard from Erminia that David was at the front line of the HIV/AIDS crisis at its very beginning, a time of tremendous uncertainty, where only the bravest went to the front to confront a challenge that literally was not even understood, except for the fact that it was killing large numbers of people. David made it his business to be present and accounted for in that fight. I want to emphasize that his abilities and his education could have led him in a very different direction. His graduate of Yale Law School, obviously we all know he could have chosen a very illustrious career in the private sector. He could have done very well for himself. I can safely say that did not occur to David. What occurred to him was to help others. Comes into an agency now that has, over decades, going back to the time that Nick Scopetta was first named as the first commissioner, an agency that has made steady progress but still has much work to do. And I want to be clear that we will be unrelenting in addressing its challenges. But I also want to express my appreciation to all of those who have served in ACS who have achieved things that were not achieved previously. A very important example, the foster care population that we're serving is now down to 10,000 children compared to 13,000 just 3 years ago. That means more is being done to help children in their families and to avoid them having to go into foster care to begin with. The number of children being reached by preventative services, this is something I spent a lot of time working on when I was General Welfare Chairman, the need to have help in the home for families that are struggling, families that can turn their reality around, need intervention, need support. Preventative services have been a difference maker for years, but there wasn't enough capacity. Well, now 45,000 kids are being served by preventative services compared to 39,000 just 5 years ago. 6,000 more kids getting help and protection. And this includes things like mental health support, parenting support, helping families to get stronger and to address their challenges. So we know that we can make change and we can make improvement, but we also know we have a lot more work to do. And now we have a leader who I am convinced will move ACS forward and will usher in the next wave of reform and change on behalf of our children and families. A few words in Spanish. Hoy anunciamos a David Hansell como nuestro nuevo comisionado de la Administración de Servicios Infantiles. Él ha dedicado su carrera a proteger a las familias más vulnerables. Su misión y la mía es proteger a cada niño vulnerable de la ciudad de Nueva York. With that, I, with great pleasure, introduce the new Commissioner of the Administration for Children's Services, David Hansell.
Good morning, everyone. I want to start by expressing my deep gratitude to Mayor de Blasio and Dr. Palacio, first of all, for those overwhelming comments, but more importantly, for giving me the opportunity to serve this city in such an important role. I am truly humbled by the confidence that they've expressed in me. I've known the mayor for 15 years. As he said, we worked together when he was chair of the General Welfare Committee for the City Council, and I was the chief of staff at HRA. And I know from that experience that I share his mission to protect every child and his deep appreciation for the difficult and challenging work that the women and men at ACS do every day. When the mayor and I were discussing the job of ACS commissioner, he asked me a simple question that I have asked myself many times, and that is, what motivates you to consider taking on this enormous challenge? And I answered him with a question of my own. Where is there a more important place to serve the most vulnerable individuals and families in our city? And that's been the question that's animated career decisions I've made over the course of my career for the last 3 decades. As you've already heard, my worldview took shape in a time of crisis in the early 1980s, when hundreds of New Yorkers were dying of a new disease that had not yet even been labeled as AIDS. They were men and women, gay and straight, predominantly people of color, predominantly young, and many of them were my friends. But universally, they were sick, they were scorned by many, and they were ignored by many more, and they needed protection. And as a young lawyer, that's what I tried to do, and that's what I felt I needed to do. So working on the front lines at gay men's health crisis in the late 1980s and the early 1990s, that experience showed me what happens when government takes a callous attitude towards those who need its help the most. But it also showed me the good that government can do when it cares for the most defenseless among us. And I have to say those lessons seem as urgent today as they did 30 years ago. And since then, I've tried to apply those lessons in running government agencies, energizing them, spurring them to innovation, and working to improve their performance. And now, as I take on a new responsibility at ACS, the agency that I'm about to lead is beholden to every single New Yorker in its mission to protect our most vulnerable children. And there is no greater calling than that. So my job will be to build on what ACS is doing well, to fix what isn't working, and to move mountains to support the work of the agency's 6,000 committed and courageous staff. And the mayor has assured me that I'll have whatever resources I need to make sure that ACS can achieve its mission. I, in turn, will apply the managerial skills and the rigor that have served me well elsewhere to move ACS forward. So specifically, what does that mean? Well, first, I will do a top-to-bottom review of ACS's protective and preventive functions to strengthen what's working and to change what isn't. Second, I will use the full authority that's been given to me by the mayor to ensure that the agency leadership is fully aligned with our reform vision. Third, I will review the many recent reform proposals to see what needs to be implemented and where we can expedite critical reforms in the agency. And fourth, I will identify opportunities for closer collaboration with the NYPD on internal monitoring procedures and on protecting the safety of our children and our staff. And to say a few more words about that, in particular, from my experience running other major government organizations, I have become a strong believer in metrics-based management. I have seen the so-called STAT model based on the CompStat model within the NYPD. I've seen it work at HRA when I was there very effectively. I haven't yet had the opportunity to see the ChildStat program at ACS, but I have some concerns about whether it is actually achieving its purpose of ensuring the kind of accountability and quality assurance that we need there. I've already had the opportunity to meet with Chief of Detectives Boyce to talk about how we can collaborate more closely with the NYPD to make sure that we are fully utilizing their expertise and expectations in improving the caliber of the ChildStat program. And that's one of the things I will be taking a very close look at as soon as I arrive at ACS. Before I close, on a personal note, I want to thank several family members here today. My partner, Rob Semino, my partner of 16 years, who has supported me in doing this, knowing that he may not see a lot of me for a while. My sister, Linda, my godson, Sam Craig, and his mother, B.C. Craig. And to close, I again want to thank Mayor de Blasio, Dr. Palacio, for this opportunity. And I want to pledge to the people of New York that I will lead and support this agency and its staff to do everything in our power to protect all of our city's children. Thank you very much.